McCoy, 65 years old, and I have kidney cancer. I'm a patient at Moffitt Cancer Center in Florida. I went to the emergency room with chest pain, so they did a CAT scan. The CAT scan showed lesions on my chest, and in the bottom corner of the shot, they could see my kidney had a tumor on it. So they thought it was probably a recurrence of breast cancer I had had a few years earlier, or metastasis. My breast cancer had metastasized. But when I had a biopsy of the lesions, they discovered it was kidney cancer. It was primary kidney cancer. Truthfully, I thought it was a death sentence in the beginning because it was stage 4. But he said, no, we can, there are lots of drugs out. He said there are at least 10 new drugs that have come out in the last year or so. And, we'll try them all if we have to, and you could probably live a very long life. I live a very normal life. My sister, when she first got the news, she told many of her friends at church and asked them to pray for me. And now when they ask how I'm doing, she says, you would never know she even has cancer. In the beginning, when my sister wanted to come along to the doctor's appointments and things like that, I thought, I don't need my big sister. I'm a big girl. I can do this all on my own. But I realized after a couple visits that it really is nice having an advocate. She goes with me to the doctor's office. She takes notes. She asks her own questions, and I can come back to her and say, what was it that he said? And she has it all in her notebook, and that's been amazing. Oh, I have an awesome daughter who's been a great support to me. I have 3 incredible grandsons and a 5-year-old great-granddaughter. And we get together once a week for family dinner. It's important to me that, someday when I am gone, that they have fond memories of me. Yeah, the big thing is you're not alone. There are, first off, there are so many Kidney Cancer Association and all these other groups that are out there to provide information. Moffitt has an amazing support system. There are social workers that can direct you with financial assistance and, therapies like massage therapy and things like that. And it's just amazing that there's hope. There's, it's not, cancer is not necessarily a death sentence, and you're not alone. There's lots of people going through it, and you don't even know it because they look like normal, everyday people.